And hello to all. So, like Yuri was saying, I'm Hanna Marttila. I'm the product manager for Steriking. All right. So, bonded wraps are the topic of the webinar today. Here. So, a little history where we have all started. So, we have now from the linen to the containers for the crepe papers. Then it had been developed for the wet-laden nonwovens, synthetic wrappings and interleaved materials. And now we are having the newest product to our portfolio is now the bonded wrap. And here is where we are today. So what is our bonded wrap? It's a sterile barrier system, which is made out of polypropylene. It is used for wrapping surgical instrument trays. You may see from the picture on for the later of the presentation that it is two of these polypropylene sheets ultrasonically sealed together. So it provides a 50% less time to pack in the CSSD departments. We have noticed that the global markets are moving more and more towards these bonded wraps. Our product is now suitable for steam, ethylene oxide, formaldehyde, and gas plasma sterilization. And of course, this is also our CE marked medical device. So what it's consisting of, it is 2 layers of SSMMS wrap, which is sealed together with ultrasonic sealing process. So you might know this material already from our SMX portfolio. So it's the exact same product structure, but just now 2 of these SMX sheets bonded together. What it is giving, it's made of polypropylene. We are now starting our portfolio with 3 different combinations, 6 sizes of each. So bonded wrap 1 is SMX 47 plus 37 grams. Bonded wrap 2 is 47 plus 47, and bonded wrap 4 is 47 plus 75 gram SMX sheet. We have long history with the SMX studies, with the third-party studies that we have made. And now, of course, we have also confirmed that our bonded wrap is fulfilling all the necessary standards and applications that we are stating it that it would comply to. So what sizes do we have? Now we are having it, like said, in 3 different sizes. You may see it from the sizes. So bonded wrap 1, the 47 plus 37 grams, they are all coming from 60 to 60 size, 75 to 75, 90 to 90, 100 to 100, 120 to 120, and then 140 to 140. So you may see that all the sizes are the same, so 6 sizes of each, and the coding is following our normal coding method that we are using with all other products as well. Then you may see also that there is the quantity per case that we are providing. So we have these are the sheets inside of one carton box, which is our minimum selling unit. So then how we are packing these, we are having them packed in similar ways that we are having our SMX sheets packs. So you may be familiar with our carton box, which is opening. It's really easy to open. You may see also that we have highlighted that the material itself or the sheets themselves has as minimum folds as possible, so that the end user is having as straight material as possible. With our packaging method, it's easy to open from the carton box. it's easy to take out of the carton box, and then it's easy from there to place on the hanging bars that are used normally in the CSSD departments. You may see there from the carton box, and then how it's in this rim that we are using also. So as a comparison, you might see that Halyard is using this more smaller packages or tighter carton boxes, but this means that the material itself is having much more of these foldings, and then it's not that easy to open. It's having this fold on the material, and it's causing much more handling of the material when opened and when placed to the storage of the CSSDs. So then, if we go to the faults and general characteristics of the sterilization wraps that we want to achieve. So we want to achieve the barrier effectiveness. We want to have good penetrability of the materials, aeration, that the materials are non-toxic. This is important to have the minimal wrapping memory that it will have. The drapability is important, especially on the unfolding of the package. The flexibility of the material, the puncture resistant, tear resistant, the toxicity that it's non-toxic, the odors, that it's odorless, low linting, that there is no additional contamination, having then of course that it would be as cost saving as possible also for the end user, and then of course that the recycling is as good as it should. So then, what are the reasons why to use bonded wrap? Like said in the beginning, it's suitable for all common sterilization methods. So for steam, plasma, EO, and FO. It's easy then to choose the material because you can use one material for all of these. It's then causing that the storage units storage don't have to be so full with different materials. You can only use the one. It's also preventing of choosing incorrect materials from the storage, and yes, less storage space totally. It also has good strength properties, which provides any cuts or any damages done in the using storage, or then re-guaranteeing the patient safety commonly. It's also proven that our SMX sheets they're working as by one, but this is now the bonded wrap is really providing this strength properties overall. The drapability is familiar from the materials that we have already in our portfolio, but really highlighting that it's easy to fold. It doesn't have this folding memory. It's faster to pack then, and then of course it's easier to unfold because there is no memory. It's draping really well in the sterile atmosphere. It's nice to touch. The material is really soft. It's really nice to use. So when it's soft to your hands, it's really nice to handle the material. There is no foldings, and then as the personnel is using them many times a day, it's really not affecting on their hand or any causing any additional damage to hands or dryness or anything like that. And then, like I said, that it's made from polypropylene, so it's recycle ready material. It can be recycled, of course, in if you have any plastic recycle in your country, or then other local disposal methods. But it's not having any additional material, so it's 100% synthetic and 100% polypropylene material. So then what we have had from the feedback from the bonded wraps from our usability studies. So the most comments we have gathered here. So it's really easy to fold and drape. What we want to highlight from this is that the handling of the material is really important, that the packing process and then of course the unfolding process are going as smoothly as possible and as safely as possible. The surface of the material is smooth, and then of course it's soft to the hands. And when they are packing them multiple times a day, it doesn't cause any additional stress to your hands or any additional dryness or any other damages to your hands or other. It's anti-static, so it doesn't attract any contamination or any dust in that sort, and also it doesn't cause any additional static. So it's also that in that sense guaranteeing the safety of the use of the package. Again, highlighting that it's soft for the fingers. It feels more functional than the currently used version. So this hospital was actually using a bonded wrap already, but this we want to highlight that there might be some this kind of opinions that what would be more functional or this way, and this is really important feedback also for us that how we can develop then our materials and products in our portfolio. There was no linting seen, so there is no additional contamination sources. It was opening very nicely, so the drapability was really good. And this is really important when presenting it aseptically in the sterile field. And then when it was packed, the tape that was used stuck really well. There was no need to press the tape onto the material, and there was no need to use additional tape to guarantee that the pack will stay intact during the process. And of course, this is really good for the packaging process, of course, on the process itself, sterilization process, and then for the storaging process that the packages are staying intact and there is no excess material used for the packaging. So I see that I have been a little faster than I was anticipating, but the takeaways of this webinar is that there is the blue and white sheet sealed together with the ultrasonic sealing technique. This also allows easy identification of any damages to the wrap because you can see easily for this color combination that if there is any cuts or holes in the materials or any other contaminations, for example. We are using very strong materials, which are really soft to use, and they are easy to fold and drape. There is no linting nor free particles detaching during use, which is really important for the product patient safety and for the usage of the product. Like stated in the beginning, it reduces the working time because you can have the sequence wrapping method done in one time. So it saves time when using this product. We have superior resistance against punctures, tears, or any abrasions. It can be used for different sterilization methods or the most common sterilization methods, and highlighting that it's recyclable ready, so it's remade from 100% pure polypropylene, and we are not adding any material or any adhesive when we are sealing it from the site.